Hey, Dr. St. John with part 2 on the gallbladder. So we talked about what bile is, how the liver produces it, the gallbladder is a sac that stores it, the gallbladder breaks down fat, it helps keep cholesterol normalized, helps you absorb the fat-soluble vitamins A, D, E, and K. It removes excess hormones from the system, which can be cancer-causing, helps lubricate the colon. So what are some symptoms and solutions to handle this? Well, some symptoms that you may have a bile issue or a gallbladder issue, you might have mid-back pain. So believe it or not, when you start to form stones in the gallbladder, which is just kind of below the right side of the rib cage, what happens is it refers back pain or mid-back pain. It refers pain right into the middle of your back between your shoulder blades. So that's a classic sign. You could have chronic constipation. And maybe you are eliminating every day, but it's not, the stool could be a little dry, or you could be skipping a day or two, that type of thing. You could have bloating, especially bloating 1 to 2 hours after eating. That's often the gallbladder, because what happens is the food starts to get broken down, and as it's getting broken down over the course of a half hour to an hour, the gallbladder is not producing that bile to break down the fat, so then the fat will putrefy or go rancid, and it will create problems like bloating and gassiness. You could have a weight gain issue or stubborn weight loss. Well, what does the bile do? It breaks down fat. So if you can't break down fat, you're going to have a hard time losing fat. Lastly here, hormone issues. If you're not able to release exogenous hormones, especially estrogen, that's going to predispose you to cancer and hormonal imbalances. And there's many different symptoms related to that. So what do we do in our clinic? Well, we assess the gallbladder through kinesiology or muscle testing, and I probably have about 12 to 15 different supplements, whether they're herbs or homeopathics or whole food supplements that help get this bile flowing. Some of them have choline in them. Some of them have beet and beet leaf juice, which helps thin the bile. We have different herbs like globe artichoke that can help. But this is not something that you can just do a cookie cutter approach and throw supplements at it just arbitrarily. You really need to be tested. You could get some results, but to take all the guesswork out, what we do is we actually have the patient here, or we do an assessment via phone, and we do some testing to determine exactly what nutrients you need, what dietary changes you need to make to get the bile flowing, to get the gallbladder functioning, to wear down the stones, because they can be worn down over time with certain supplements. They can be emulsified or broken down, right? Because what is bile? On video 1 we talked about that. Bile is like a detergent. It will break down the fats. And when they harden, like gallstones, they can be worn down. So if you know someone that is being told they need to have their gallbladder out, I suggest you find a practitioner like myself to refer them to, or if this is you, the gallbladder can be saved. You really want to try and keep your gallbladder, if at all possible, because you want to be able to break down these fat-soluble vitamins and also essential fatty acids like fish oil and that type of thing, which are so healthy for us. So any questions, comments, please leave them. We're here to help at Chagrin Natural Health Clinic. Take care.